Hello, everyone, and welcome to MyCHN podcast, Health Conversations Without Barriers. I am Mariela, and this is
I am Lulu.
from the marketing team. And today we are going to be talking about maternal health. With us, we have Cheryl Gibson, Women's and Children's Family Nurse Practitioner at MyCHN, Ty Stargill, MyCHN Social Determinant of Health Manager, and Nidia Garcia, Evaluator and Quality Director at MyCHN. Thank you for being here.
Thank you very much.
And in honor of Black Maternal Health Week, we'll be talking about maternal health today.
All right. Well, hi you guys. It's Ty. I have a couple of questions here that I really just want to kind of gauge Ms. Sherelle and Ms. Nidia and kind of pick their brains on things as it relates to maternal health. So either one of you can go, but can y'all talk to us about some of the policies and resources? What does it look like in the public healthcare system regarding maternal health?
Well, we have had the privilege of President Biden on April 10th declaring this to be the Black Maternal Health Week. So it will hopefully carry on to be between April 11th through April 17th of every year, so that the disparities that we have in healthcare can be recognized, can be focused, and solutions being made. So in honor of that, that's where we have a lot of our resources coming from. So we have quite a few government-based resources. We would start with the Department of Health and Human Services, who has provided initiatives, programs, funding in the millions of dollars to help community-based programs. So MyCHN as a FQHC will be participating in these funding programs to assist maternal fetal health, pediatric health, and just all around women's health. Some of the other services that people are familiar with is WIC. So being able to provide not only nutrition to our mothers, families, babies, but they also provide services like lactation help. So those who are breastfeeding, being able to get counseling, being able to get help, whether it be on the phone or in person, those are very important services to our population.
Well, thank you so much. That was pretty elaborate, and I'm thoroughly impressed because a lot of us aren't aware of what's available to us right away, and so that's why we're doing this podcast, because this kind of information is really, really important. I want to say, Nydia. Okay, Nydia, would you happen? I know that you have two babies of your own. So, were you able to take advantage of any of these resources that may have been available to you through your insurance, or just talking through family and friends? Or did you experience any patients that may have talked to you about some of these resources?
My best resource was joining support groups online. At that point in time, there were Facebook groups available. I think technology has advanced a little bit more. So there are several different platforms where you can find support. I did find them supportive because there were moms from all over the world or all over the country that would be awake and able to respond, and kind of that peer support at all hours of the night during breastfeeding and other types of challenges that we were going through at that point in time. I would say with that particular support mode, just to keep in mind that if it's not serving that particular individual, did you maybe try to find a more supportive support group? I know that there's rules of engagement, rules of conduct on online forums, but sometimes there can be a little bit of guilt or, oh my gosh, you co-slept, or, some of there's these trigger topics that, I won't get into all those specific ones here, but generally things that involve particular styles of sleeping and eating and just very basic care. There have formed camps of what is right and what is wrong, and very strong opinions. So don't necessarily want to get into that when you're just a new mom trying to, or even a second time mom or third time mom trying to seek out some support. So those are some things that definitely helped me, but just, I guess, some parentheses around those as well as to what would be helpful.
Yeah, it's interesting that you mentioned like the online forums, because during the pandemic, a lot of women were like participating in drive-by baby showers, just so people could feel like welcomed and, be a part of like the birth of the new baby and celebrating and all those things. And so I know for my fourth and last baby shower, I decided I would do the drive-by baby shower. And the concept, I guess, I did not relay very well to my own family and friends, so nobody showed. And it felt kind of bad, but I had an online support on Facebook. I was in like 3 VBAC mommy support groups. And for those who don't know what VBAC is, it's vaginal birth after cesarean. So, and I had 2 cesareans, and I was so eager for me to give a natural birth. And I joined these groups to help with supporting me in this new endeavor. And let me tell you, I had baby shower gifts at my front door from all my online friends. Someone as far as the UK sent me baby gifts. And it was an amazing feeling to know that all these women I had never even met face to face were so supportive. And I sent all of them thank you cards because it was a really great feeling and experience to be a part of. So those kinds of things are important. Getting into it, during each stage of pregnancy, okay, most of us are anticipating like this really positive experience. And, for many women, it just isn't always the case. Mariella.
So actually, this is more of like a family it was told by my mom. She said that one of her aunts in El Salvador, we're talking about probably the 70s, 80s, died during birth. And my grandma had 10 children, all, natural, twins sometimes. And I said, well, things are different now. Things, it's so much better. Yeah, that was rural, and there was no doctor around. So numbers must be much better. Like in number, women probably don't die as much. They don't really have that many complications. But there is actually data that is showing us that that is not the case. Right, Ty?
Yeah. So what we're dealing with now is, as of 2021, the maternal death rate was 32.9% compared to the 23.8% in the year before. And most women died from preventable complications. When we look at Black maternal mortality rate, the rate is at 69.9 deaths per 100,000 live births. This is 2 times more than white and Hispanic women. So what I want to address to Nydia and Ms. Sherelle is, why do you think these rates are so much higher?
Well, maternal fetal death rates in America is a very complex issue. It has a variety of contributions as to why it's that way. It's very multifaceted. One thing is implicit bias and racism in the healthcare community. Particularly the reason why I am very passionate about the field that I am in, particularly the women's health specialty, is because those numbers include me. Of course, I did not die, but I had a difficult birth. I have a difficult birthing story. I had a difficult pregnancy. I was a high risk pregnancy, and my symptoms were ignored, which could have cost my life and my baby's life. And we are blessed that she's still here, and she's 8, and she's healthy, and she talks too much. We are we are blessed for that. But I was part of those numbers, not of the mortality, but of the morbidity. So my symptoms were ignored.
Yeah.
Did it have to do with, I was expected to know because I was a nurse at the time. I was not a women's health nurse, so I didn't know the signs and the symptoms. Was it because of a racial implicit bias? Who knows? But all I know is I am part of those numbers. And then you have to talk about access. At the time, I had insurance, but I know that there was someone very close to me who was pregnant as well. She did not. So what are her resources? Her resources are going to look a little bit different than mine. And then you have to take a look at the social determinants of health. We have some pregnant ladies that are homeless.
Yeah.
How are they going to get to their visits? And then we have issues with data collection, because are we truly including everybody in this data? What about our undocumented sisters? Yeah. What about them? You also have to take a look broadly at addressing the systematic racism that we have, where some communities have ready access to healthcare because they have clinics that they can afford down the street. And then we have some that are rural, and there's the closest thing is going to be a gas station. So we have to take a look at all of those factors in one. Ultimately, exactly. Solving the issue is just as complex as the issue, but it's a comprehensive, it's going to be comprehensive problem solving and multifaceted.
Yeah, that you hit the nail on the head right there. I was just thinking, like, we are people relying on other people to like be void of their bias and their prejudice when they're caring for us. Even though they take an oath, everybody doesn't abide by the oath if they have to take one. And so at the end of the day, providers and anyone who's coming in contact with our patients, they should be like immediately addressing everyone with empathy and dignity. Nydia.
Yes. Before I joined mental health, I worked in risk management and quality, healthcare quality. And one thing that comes to mind is many of the initiatives that help to avoid mortality, such as in sepsis. And here we're talking about this beautiful topic of maternal, not that death is beautiful, but maternal life. How can we avoid that? What's preventable? I too had a very close call in delivering my second child due to postpartum hemorrhage. And in hindsight, I had an underlying condition with the placenta adhering that could have been detected at the onset during my prenatal care. And so I too, being a healthcare professional, I feel that I put an expectation on myself, or my OB was actually from the hospital where I was working. So that complicated matters as well, with this assumption of I should know, even though I wasn't a maternal care person. I was a quality and risk person. And so in hindsight, just like Sherelle has explained, yes, the solutions will be complex. But one thing that can help is, in hindsight, I wish that I would have been more preventive to ask simple, basic questions like, what is the worst possible outcome with my pregnancy? What are the trends on maybe my race, my ethnicity, my age group? And then what are possible risk factors that we could possibly discuss here and now during my prenatal care that might help me to be better prepared? And so just a little bit more specific example, since postpartum hemorrhage and preeclampsia are two of those conditions that do predispose that mortality. So the placenta adhering was something that had happened on my first pregnancy, but I didn't know that that was considered a complication, that I should have told this different OB for my second child regarding my care. And so, again, if I would have maybe asked those preventive questions, I would have known when she asked me, did you have any complications with your first pregnancy? And I said, no. I was in healthcare and I said, no, because I didn't know better. I would have known better to say, yes, I had placenta adherence That was a complication at the birth of my first child. It was managed, it was controlled. So I didn't have an adverse outcome, but it is something that I should speak up and say now during my prenatal visit during my second child. So those are just some thoughts. And I see Cheryl also.
So my thing is, I just don't see how that falls on you. That's just, I'm sorry. That's just how I see it. I feel like I'm overwhelmed and I've never been a mom. I can't imagine like being pregnant and how will that fall on you? I'm sorry. I just don't think that that's something that should fall on you.
Ms. Sherelle.
Education, education, education. As a provider, we should be doing more talking than anything else. We should be educating our patients in the front, in the middle, and in the end of care. Because at the end of your care, Nydia, it should have been a breakdown of, okay, postpartum care. Let's go back and let's look at your care throughout your pregnancy. Let's look at your care with your delivery. What went wrong? What went right? So that the next time that we do this, we can keep an eye out. We can make sure that you are possibly flagged as high risk. So we should be seeing you more often. We should be getting you to a specialist. So education, education, education.
Cheryl, I was actually going to ask, do you see more women asking more questions nowadays? I do know that like there's a lot of things that we can Google and the internet does provide, but during stages, whether it's like first baby, second baby, do you think women are asking more questions?
Oh, my ladies live online. My ladies live online. They follow step by step of how big their baby are. They join groups. They join support groups. And then I may have to combat Instagram, TikTok, and other social medias that may be putting out bad information.
Oh,
so yes, my ladies live online, and it is myself as a provider, a love-hate relationship with social media and the internet. So I invite questions. I invite fear. I invite anxiety into my visits because I want to dispel them, or I might want to acknowledge them and say, this is what we're going to do about it. So I do a lot of talking during my initial OB visits because I'm going to tell you everything that you need to know and that we are likely going to experience or possibly experience through the course of your pregnancy, whether or not this is your first or seventh child. I'm going to do a whole lot of talking. We shouldn't, as providers, assume since you are a nurse, since you are of higher education, since this is your seventh pregnancy, that you know already, because it's very likely the person does not. So I talk to everybody as if they are a brand spanking new mom, first pregnancy, and we're going to be going through this together. And this is what you should keep an eyeball out for. And this is what I'm going to keep an eye out for, because we want everyone to have the knowledge they need to have a safe and happy and healthy pregnancy and baby at the end.
Absolutely. Nydia, it's funny, I actually had a question for you too, and you may address this, but go ahead.
Well, I was going to say that I completely agree with Sherelle and the education. I think her patients are just so blessed to have access to that level of education. I think too is an opportunity to what they call medical literacy or healthcare literacy in breaking down the questions at the point of the provider assessment. Like I said, between my first and second child, I went to different OBs. It was two different OBs. My job changed, so my insurance changed, so I had to switch. And when that second OB asked, did you have any complications with your pregnancy? I said no, although my first OB had told me you had placental adherence, et cetera, but I did not still consider that to be a complication of pregnancy because in my, maternal care mind, that was a complication of labor and delivery, not a complication of pregnancy. So my answer was still no. And so in hindsight, I wish that maybe if there was a little bit more of a specific intake, did you have placental adherence, which is one of the most common risk factors for postpartum hemorrhage, which is one of the biggest contributors to maternal death. That specific question could have prevented me receiving 4 rounds of epinephrine while trying to give birth to my daughter.
Wow.
My second
Lydia,
delivery.
you know what? That segues into a really good question now. And I know you ladies are pressed for time. Y'all are super busy. So this is my last one for y'all. In that case, if someone is worried or they feel like something's wrong, but they don't feel like they're being heard, what do you think the next steps should be? Like, you work in the risk management side before, you're doing mental health now, and you've been a patient in this very position. With all of that experience, what should she do?
Patient advocate. So this is a person, a trusted person. You want someone who speaks up and does so under pressure, and preferably someone who knows you well, because when you're a patient, you may be going through it in that very moment. You might go into a frozen response, flight or fight. You don't even necessarily know how you're going to respond. And so to put that expectation on yourself, even if you are a healthcare professional or any other type of professional, in that moment, you are a patient. And so having that patient advocate, or some people call it a support person, to be there with you, come to your prenatal visits, come to your labor and delivery room, be present, receive the same education that you're receiving, read all the books with you, download the pregnancy apps with you, all of that. That person can really help you. And for me, that person was my mom. After my daughter was born, I had my mom and my husband as my support person. My husband left with my daughter thinking everything was fine. They were just kind of doing the final steps. And then he was not aware what my mom and I were going through. And my mom was that support person that was able to speak up in real time. I was also advocating for myself. Thankfully, I did have enough of a mind in that present moment to speak up as the situation was unfolding. But that would be the biggest advice, to have a patient advocate. And then also to not be afraid to make some noise. So in a hospital system, it's going to be the charge nurse that it can be escalated to, the nurse supervisor, the nurse manager. Ask specifically, I would like to speak with the charge nurse, or I would like to speak with the nurse manager. Very specifically, that's going to get more attention. And generally, the individuals at a higher level are going to be more seasoned clinicians that would be able to spot if something is going awry clinically and be able to intervene. Those would just be some talking points.
Thank you, Nydia. That is seriously much appreciated, because there are a lot of women who don't have the first inkling or idea how to be an advocate for themselves, or how to reach out to an advocate. So, and I'm a living, breathing testament of that portion of it, unfortunately. So, but at any rate, Nydia and Jarrell, I know y'all gotta go. I really appreciate y'all for being here. Mariella?
So we're going to get to a second part of this podcast, which is going to touch on the prenatal care, and then, delivery, all that. So stay tuned for that podcast. I would like to thank Ty, Nydia, and Sherelle for being part of this podcast and actually touching on a very touchy subject that is affecting a lot of women in this country. And don't forget to share this podcast and demonstrate your love by giving us a review on iTunes, on Spotify. Until next time.